Hello everyone, I'm Dr. Andy Gould at Advanced ENT and Allergy. Each week we take on your questions from our social media and we try to answer them. You can ask a question using the hashtag AskENTDoc or simply ask a question under any of our posts on social media. Then tune in next week and we will see if we can discuss it. On this episode we will talk about ear tubes, snoring, and home remedies for sinus infections.
How many ear infections does my child need to have before I look at ear tubes as an option?
General clinical guidelines would indicate about 5 to 7 episodes of otitis media or ear infections before considering ear tubes in a year. Now every child is different and there's a lot of variables. For instance, I sometimes will look at the severity of ear infections, how many antibiotics it took to get rid of an ear infection, complications associated with ear infections, how bad the symptoms are, and also we'll look at things like family history, risk factors like daycare. There's multiple factors, so we can't just put a simple number of infections, but a general guideline is around 5 to 7. Another thing to keep in mind is another reason to consider ear tubes is not number of infections, but prolonged ear fluid contributing to hearing loss. Ear fluid lasting longer than 3 months is known to be associated with speech delay, and that may prompt us to act as well.
Are there any home remedies for helping sinus infections?
If you think you have a sinus infection, then there are some things that you can do at home prior to seeking treatment. We all live busy lives, and so sometimes it's nice to be able to get something to clear up without seeing the physician or getting an antibiotic. I think one of the most effective ways to get rid of a sinus infection is a 3 to 4 day course of a combination of Afrin nasal spray followed by a saline flush followed by a nasal steroid. And that can be done 2 to 3 times a day. Nasal steroids are now available over the counter. Afrin is also over the counter. It's important to remember on Afrin that you cannot use that consistently because that becomes very habit forming. But just for a few days to treat a sinus infection coupled with saline flushes, I think it's a good option.
Does snoring indicate a health problem?
Snoring in children can indicate that there is a health problem going on. It's not typical for kids to snore loudly at night. Now, if they have a cold or something's unusual, they may get some temporary snoring. But if it's a nightly problem, not loud snoring associated especially with pauses or apnea in their breathing, then that should be looked at. One of the most common causes I see is enlarged tonsils and adenoids. And obstructive sleep apnea in kids can cause a variety of problems, from just simply behavioral problems to school performance to other medical issues.